Good afternoon. Welcome to another NYSAC County Finance School webinar. My name is Mark Levine. I am the Deputy Director of the New York State Association of Counties, and on behalf of our President, Jack Marin, and our Executive Director, Stephen Aquario, I want to welcome you to this afternoon's webinar. Today, we will be presenting a program on the American Rescue Plan. President Biden recently signed the American Rescue Plan Act, which includes provisions to provide direct federal assistance to counties to stamp out the pandemic once and for all, and to begin the long process of restoring and rebuilding our economy. We will hear about what the bill does and Treasury guidance on how counties can use these funds. First, I want to turn it over to Kate Pierce, who will provide some housekeeping announcements.
Just as a heads up, this webinar is being recorded and will be posted later today with a PDF of the slide deck on NYSAC's website at nysac.org under the Education tab. If you would like to submit a question during the program, please type it from your dashboard under the Questions tab.
We are honored today to be joined by two distinguished panelists from KPMG. Thank you both for joining us. Jeff Plant is a partner in KPMG's advisory practice and the lead account partner for New York State based in Albany. He is focused on state and local government clients with an emphasis on business transformation and technology enablement. He has more than 29 years of experience serving public sector clients, concentrating on finance, procurement, and administrative functions. He has worked with many New York State counties over his career and has a deep understanding of the issues facing counties and the interactions between counties, the state, and the federal government. Rory Costello is a principal in KPMG's government regulatory compliance practice and serves as that group's National Emergency Management and Disaster Recovery co-leader. He has been with KPMG since 1995, first joining the group as he was working towards his Master's of Science in Accounting degree. Rory has extensive federal funding experience as well as state and federal compliance experience, having served on numerous regulatory compliance engagements, including a number of federal single audits. A certified project management professional, Rory brings over 25 years of large project management experience. He has extensive experience interacting at all levels of an organization and is an accomplished facilitator, presenter, and trainer. Thank you both for joining us this afternoon, and I'd like to now turn it over to Rory Costello.
Thanks, Mark. Really appreciate the opportunity here today. As Mark indicated, I'm Rory Costello. 25 years with the firm. 23 years of those 25 years have been spent working in the state of New York and with various counties within the state of New York, especially early on in my career. As Mark indicated, we're primarily in the regulatory compliance, grants management, and costing space. As with everybody else lately, all things have been COVID-19 related, as I'm sure they have been with you. All worked with various states and counties on a myriad of COVID-19 related items. A lot of oversight and monitoring, as you can imagine, a lot of assistance trying to understand the various funding streams that have come out and what's eligible, what's not, what's eligible, what's not eligible, what's allowable, non-allowable, things like that. Again, thank you to Mark and to Jack and Steve and the association for this opportunity today. So, what's on the agenda? Mark gave you a quick sort of little snippet there, but we really want to discuss, Jeff and I, two primary items. So we'll start off with, a quick overview of the American Rescue Plan. We'll talk a little bit about uses and programs, non-uses, things that are unallowable, things along those lines. We'll talk about timing. We'll start at a relatively high level, talking a little bit about what's happened, over the last 15 or 16 months, high level, get down into some specifics, but, this is going to be high level today. Anybody who's taken a shot at reading pieces of any of these acts, especially ARP, you realize, an hour is probably just not enough. So we'll stay high level. Just want to tell everybody, like, you should always, consult with counsel as you're making decisions as you go along. So once I'm done with the American Rescue Plan, I'll then turn it over to Jeff, and he'll talk through some items you might want to consider as, the ARP previous COVID monies. And then, as always, we'll leave time for questions. What we can answer, we'll definitely take down, and we'll feed an answer back through NISAC, so we can make sure that we're meeting anybody's needs. So with that, Kate, why don't we flip to past the cover, and there we go. So just a little bit of background. These are probably things many of you knew or at least suspected, but it gives you a sense of why so much money has been put out there. When you kind of step back and you think about the impacts, the impact on households. 3 million workers dropped out of the labor market, relative back to February 2020. There's somewhere in the neighborhood of 17 million adults that didn't have enough food through this. There's low-income communities or underserved communities have been adversely impacted by this. Heavy impact on small businesses. Somewhere in the neighborhood of 70% of all small businesses in the country impacted. 400,000 closures at some point. As we all know, the unemployment rate, relative to April 2020, was the highest unemployment level in over 70 years. And then there was a specific impact in terms of the infection rate, to Native Americans, disproportionately affected, more than 1.5 times the rate of COVID-19 infections, and more than triple the rate of hospitalizations. And then you have things, which you would expect, a large increase in substance abuse, and a 30% increase in overdoses. So as you can imagine, if you just take that into account and don't even put into account, the amount of people who passed away and the the infections and the hospitalizations, this is a very, very wide-ranging thing, in a very, I'm sure it feels like, for everybody, it feels like it's been happening forever, but it's only about 14 or 15 months old, and obviously the impact of this has been quite deep. So with that, with that sort of backdrop in mind, and that, that sort of getting us all on the same page, we can go to the next slide, Kate. There's been, obviously, several acts, a small amount of money. On March 11th, though, the American Rescue Plan comes into play. Again, adding into the multiple funding streams that have already come out through CRF and a few other things. Again, mostly a good thing, right? There's things that we need to do with that money. There's needs and impact that we need to address. So a good thing, and a good thing to have that money at our disposal for the most part. But then also a challenging thing where it just adds to the level of complication. There's significant responsibilities on behalf of state and local governments. But overall, the objectives of the American Rescue Plan were to meet urgent COVID-19 response efforts, to replace lost public sector revenue, to drive improved economic stabilization of households, and then obviously is to address any systemic public health challenges. Two major pieces of this, two major sections out of the Social Security Act, Section 602, states, territories, tribal governments, and Section 603, which is really the fund for metropolitan cities, non-entitlement, and units of local government and counties. That's sort of how they sort of broke that out. Obviously, the Treasury, was expecting to provide technical assistance to just defray the cost of administering all this. And then again, there was a big push about engaging communities and constituents to help with the planning side of this. So that's a little bit of background. Again, I said we'd start kind of high and sort of narrow ourselves down into some specifics. So moving on to slide 6. The next slide. Again, here, like just this sort of a cross section, just to give you a sense of just how much money and how far-reaching this is. So $1.9 trillion coming through the act, covering either 45 new or amended funding streams. A fair amount of money obviously going to households, a lot of money going to businesses, a lot of money going to communities, and again for various uses. So there's money set aside for state and local response, what we call American Recovery and Fiscal Aid, emergency food and shelter, funeral expenses, family aid for COVID deceased, emergency connectivity funds for, for library connectivity, through various, different funding streams, state and local fiscal recovery program, FEMA PA grants, and then transit operating infrastructure funding. But it doesn't stop there. We've got several more agriculture and nutrition related programs. So food supply chain support, farm load assistance, pandemic EBT programs coming through supplemental, nutrition assistance program, SNAP, and then obviously through WIC, Women and Infants, Children Nutrition Program. Keep going, education and community and health services related aid, both state and local, money to Head Start, my money to travel school aid. I've actually helped several clients on this side, with their, emergency and secondary school relief funding, the GEAR funding, higher education, emergency relief funding, and then obviously the stabilization and block grants that go with that as well. And then continuing on, the housing and related aid, I think everybody kind of knows about what was going on in there. Assistance for rural housing, housing vouchers. There was emergency rental assistance. Now there's homeless assistance. Now there's homeowner assistance fund. So a fair amount of money there as well. And then obviously, healthcare and public environmental health aid type things. So vaccine development, testing, and confidence, global health capacity building, surveillance, and that money flowing through a bunch of different places, the vaccine distribution and tracing, community health centers, water utility rebate programs, and then obviously through Medicaid. So when you kind of step back and you think about the last two slides that we've gone over, a very wide ranging set of objectives for ARP, adding to multiple funding streams, and then a fair amount of money, $1.9 trillion covering a very large, wide, diverse array of funding streams, both new and existing. So on to the next slide. Okay, so it sort of like this sort of steps back and sort of it puts it kind of all in perspective in terms of supporting the public health response, and that was really kind of what ARP is being set up to do. So there's money set aside for mitigation and prevention, money set aside for medical expenses, a set aside for behavioral health care, expenses to improve healthcare programs, and public health and safety. But again, like it's, while there's a fair amount of money come out, there's obviously eligibility and allowability that comes through that, comes as part of that. The money must be spent in response to the pandemic. You need to identify a need or negative impact of COVID-19. And then, when you're spending that money, making sure that you're taking into account how does that program address need and impact. And I think I can stop right here and say in a lot of the oversight and monitoring work that I've done, I've really kind of come across a couple different things. And in certain instances, especially when the coronavirus relief money came out and some of the other monies came out, speed was a big impact. There was very urgent need. The money was asked to be spent very quickly. There's the struggle there for many clients that I have about holding on to, the right amount of supporting documentation. But then, so supporting documentation, is a bit of a problem for some people. Then I think in other places where there was some sort of support, it just wasn't, well explained. So I see an expenditure come through, but it doesn't, there's no real kind of explanation or information around, how does this address the pandemic? How does this address an urgent need or an economic impact? You should always be sort of keeping those things in mind. There's rules around the supporting documentation, but there's also rules around, what's allowable, what's not allowable, what's eligible, what's ineligible, and you kind of should sort of think those things through as you're going. And with this ARP, obviously it extends, the CRF, but also has, a bit longer of a timing towards it, which should make things, I wouldn't necessarily say more comfortable, but maybe a little bit easier in terms of making sure the documentation there and making sure that your explanations and your rationale for, why the money was spent the way it is there. Next slide, please. So, addressing the negative economic impacts is also one big piece of this. Obviously there was, a fair amount of money for assistance to unemployed workers, money into the state UI trust funds, money set aside for rehiring state and local and tribal government staff, improved economic relief programs, and assistance to households. And, I apologize for, the sheer amount of information on there, but we knew it was going to be posted and we were trying to be complete. So, I'm obviously not going to read through the slides, but the information, I just wanted to point out the information is there, post this presentation. But again, what you're doing here with with this negative economic impact type use is assessing the connection between economic harm and COVID-19. How do your funds address the harm? That's one thing. And then obviously eligibility is, did the harm result from COVID-19? Again, back to what I was just talking about in the previous slide, having that rationale, where the money is being used to satisfy the objective, in this instance, a negative economic impact. Moving on to the next slide, similar topic. Again, a little bit more about addressing negative impacts. While there was additional flexibility. So there was that list that I just had on the previous page. It's not supposed to be, it's not an exclusive list. It's actually not non-exclusive. But the way this works is there was additional flexibility to use the payments for other things. One of the things we just talked about opening up is the sheer impact on small businesses, and you can add not-for-profits in there. Obviously, we lean on our not-for-profits, especially in the provider space and things along those lines. They have been, adversely impacted, especially if they were, giving any sort of congregative care or things along those lines. But then there was also money being set aside to, for aid to impacted, industries, tourism, travel, hospitality, things along those lines. So while that list on that previous page is, I wouldn't say it's necessarily exhaustive. There is other ways that the money can be spent, and there is a little bit of additional flexibility associated with that. So, moving on. Some other thoughts around where the money can be spent. Again, supporting the public health response, which is obviously the overarching thing, is through qualified census tracts. So again, using the money to respond to COVID, investments in housing and neighborhoods, addressing educational disparities, driving or promoting healthy childhood environments. And again, what does all that mean? How do you become eligible, and how does the money become allowable? Certain services are eligible in qualified census tracts. To be eligible, it has to be in a place where the pandemic disproportionately impacted public health or economic outcomes. Very important. And then obviously it's got to be specific to households or geographies that were, again, disproportionately impacted. So this concept of qualified census tracts is out there as well, and money set aside obviously to address any disparities or underserved or unserved populations. On the next slide is the concept of, I believe, premium pay. And, this is one of the things where, especially in the beginning with CRF and a few others, there was an awful lot of questions about, emergency pay and things along those lines. Here, I think one of the things to sort of take away from this is, 25% of essential workers were already in the low income threshold. 13% of those were in high risk households on top of that, which again, then they're assuming, added a health risk. So this concept of premium pay, makes, funding eligible for, in areas of social service, childcare, public health and safety, truck drivers and transit staff, sanitation and janitorial, farm workers and food production workers, staffing and nursing homes, all the kind of things you would think of what would pass for, what we would consider to be, an essential worker. And then you also see on this slide, some, again, how the money is to be spent, or how the money becomes eligible, up to up to an additional $13 an hour in addition to existing rate wages, but not to exceed $25,000 per person in the aggregate. Must be additive in nature. It's to be paid retrospectively. Third-party contractors in given situations can be eligible, and in certain instances, if the premium pay would increase a worker's total pay above the 150% of their state's average annual wage, then some written justification is required for that. So this concept of premium pay, again, to kind of help those in the greatest needs in the essential worker space that were sort of already in the low income threshold before all this started. So, and then another one that is continually coming up and was obviously bandied back and forth on the next slide, Kate, by Congress for quite a bit, was the concept of revenue loss. So before the money that was made available by the previous administration and the current administration, there were heavy budget shortfalls being forecasted, and in this concept of revenue loss is to use that revenue to avoid cuts to services. So if you sort of take a look back at some of the data, state taxes were down 4.3% back ending in September 2020. So as you can imagine, that is a really high amount of money when you're trying to provide services and things along those lines. So to calculate the loss, there's that calculation across there, those 4 steps. Basically, identifying revenue collected prior to the pandemic. Estimating counterfactual revenue is step 2. IDing actual revenue, and then basically step 4 is essentially 2 minus 3, and then you come out with your number there in terms of revenue loss. You can take a look at that. It's a little bit more convoluted than what I just said, but the slide does give you a few more specifics there. Again, interestingly enough, recipients, you have broad latitude to use the funding to support your services, especially in the areas of fire and police, school, environmental, health services. One of the things is obviously, and it's been in the news quite a bit lately, is the modernization of cybersecurity was one that was added into this, and I have clients that are working quickly to try to use that. And then again, in certain instances, maintenance or pay-go funding of building infrastructure, including roads, which I think was a little surprising, considering that that infrastructure bill that Congress is currently debating is sort of right behind this one. So again, a wide array of uses relative to the impact that the pandemic has had on us. So on to the next slide there, Kate. The set aside, there's also money being set aside for investments in infrastructure, in particular, water and sewer. And you can sort of see the slide that we put together in there. Again, a pretty wide array of items around water and sewer, including energy reduction required to treat drinking water, things associated with climate change. Climate change is kind of all over the ARP as well. Again, cybersecurity is in there, reduction of lead piping, providing relief for natural disasters, green infrastructure projects, stormwater system resiliency, and then you can sort of see on the right-hand side that eligible uses are projects that come through the EPA Clean Water Fund or the Drinking Water Clean Water Fund or the Drinking Water Fund. So they also indicate you need to use strong labor standards. Your projects must have some level of public transparency. You have to maintain service that health-based. Have to maintain the service that meets the health-based standard. Taking into account climate change. So again, a broad brush. Allowed to use it for a lot of things, but there are some rules around that in terms of allowability and eligibility, things along those lines. So Kate, on the next slide is one that's been a relatively hot topic around broadband, and I think I think one of the last estimates that I saw, and I think it's even on the slide here somewhere, is that 30 million Americans are living with no access to broadband, which obviously when we went into lockdown in large swaths of the country, that impacted people's ability to go to school, kids' ability to go to school, access to healthcare. There's it's hard to do telemedicine when you don't have broadband, and then obviously the ability of people to do work from home. So three key concepts on this slide, everybody, is the concepts of eligibility, scalability, and the impact or the ability to serve the underserved. So eligibility, services, have to be at adequate speeds to the underserved. Scalable, it's got to meet or exceed the 100 megabytes per second rule. That's one of the things. And then obviously, the money is looking to impact the unserved or the underserved if they're lacking wireless capability. So another big thing that came out of ARP was to really sort of increase that connectivity, that use of broadband, and get us in a good spot there. So next slide, I think, is one you all probably know and have felt acutely. Certainly, I'm sure you're all well aware of ERA, the emergency rental assistance, funding that was covering past and future rent and utility costs. And then, that's on the heels of homeless assistance services, and then, homeowner assistance funding. Obviously, there was, moratoriums in many places on evictions, which means landlords were getting paid, so it was sort of all down our continuum there. The renters or the mortgage, the people paying the mortgage struggling. Again, one of those ideas or one of those, funding streams in order to, to kind of, help people get back on their feet in terms of, the housing side of things. And then on the next slide, getting back into this concept that I talked a little bit about before, I'll just kind of zip through this one here. Obviously increase in funding into SNAP and into WIC. A set aside, obviously for greater modernization, more innovation, and more outreach. And by modernization, that's more tech for enrollment and research, right? So the recertification process. Innovation, the money being set aside to think about in alternatives to make enrollments easier than they are currently. And then outreach. One of the things is the WIC coverage was declining and the program was reaching only about half of eligible families. This money set aside to do more outreach, in order to get more people into the WIC program. So that's a lot of what's in ARP. That's by no means everything that's in ARP. Like I said, kind of high level, got down into a little bit of the details. So let's talk a little bit now about ineligibility. We'll talk a little bit about recruitment, and then I'll finish up with some thoughts around timing. So Kate, next slide. So ineligible uses. Think about it this way, and this is kind of how I've always sort of looked at this. Is it always sort of starts with there was sort of restrictions to keep ARP funding to augment existing activities and pressing needs. So there's this concept of pre-existing limitations. Payments from the fiscal recovery funds are subject to limitations provided in other federal statutes. So that's one of the ineligible uses. Things around reserve funds, contributions to rainy day funds or financial reserves, not permitted. Offset reductions in net tax revenue, it's pretty self-explanatory. Interest, debt costs, and debt issuance also ineligible. Deposit into pension funds, other types of obligations, arising pursuant to sort of settlement agreements or judgments or consent decrees, things along those lines. And then obviously the general infrastructure that wasn't covered in the things that I said before about water and sewer and broadband and things along those lines. And obviously there seems to be another infrastructure package, that seems to be imminent. And again, these restrictions, and I said it in the beginning of this slide, and I kind of mangled it, so I'll go back again. The concept around these restrictions was to keep the ARP funding so it would augment existing activities and pressing needs, not to go fill every nook and cranny. It was to go really, again, if you go back to the very first slide or the second slide that I had, it was really about, as they all have been, has really been about COVID-19 in response to the pandemic and things along those lines. So that's sort of ineligibility in a nutshell. There's more to it than that, and obviously we know that there's certain grayness and things along those lines. I think that was one of the bigger challenges around coronavirus relief funding in the beginning was like if I do this, will it be considered allowable? Is that eligible? A lot of conversation with clients around those things. And going back to some of the things I said earlier, Treasury continues to update their FAQs and things along those lines. So you should keep your eye open for those. I think actually another set came out late last week as well. So as the PRAC moves out and starts to that grouping of OIGs, as it moves out, starts to do its audits, as quarterly reporting continues to tick away, we'll start to see more information come out about allowable uses and ineligible uses and things along those lines. It's really, really important to stay on top of that. Going to the next slide, and I'll wrap up here in just another couple seconds and turn it over to Jeff. Is there was a designated recruitment process. I think for those of us who I spent a fair amount of time in the natural disaster space, we call it a clawback euphemistically. And again, it comes down to sort of three things. Like there's you have a violation. There's there's a process to be reconsidered once you've been cited for a violation, and then there's the concept around repayment, right? So the violation is just what you would imagine it to be. It's to fair to comply to whatever restriction or the standard that is being used in place. It's based on your quarterly reporting. My guess is it's also probably going to be based on anything that gets audited down the line. And obviously the reporting is quarterly. But then once you get a notice of violation, you can put a request in for reconsideration, right? So you have an opportunity at that point to submit additional data. And again, going back to that concept I said before, you got to hold on. You got to hold on to your support. You got to hold on to your data. You got to have rationale for how you spent the money. Very, very important. You have to put a written request in within 60 days in order for the reconsideration to undergo review. And then for lack of a better description, if you get a violation and you either go for request for reconsideration, you don't get it, repayment is within 120 calendar days of receipt of any final notice of recoupment, or if you haven't requested reconsideration, it's 120 days from the initial notice provided by the secretary. So that's the sort of recoupment clawback process, sort of again, like in a nutshell. And then let's go real quickly, in terms of timeline and up in some key dates on the next slide. As you guys know, Kate, if you can switch to the next slide. There we go. Sorry. As you guys know, the payments came along, in tranches to local governments and to certain states, and the idea was that splitting up the payments does a couple different things. It gives you the ability to adapt, as warranted. It goes back to what I said before. More information coming out from Treasury. We're not all the way through this, so things are changing, and the ability to give you money up front, and then I believe it's 12. And the second payment comes about 12 months after the first payment. That sort of different differentiation of the timing gives you the ability to adapt as warranted and adapt almost as you go. So I dare say that I think by the time the second round of money comes out, things will have changed a little bit. There'll be a different set of needs. Should be able to have the ability to go from there. And then on my final slide, some key dates to kind of think of. As you kind of go through this, and it's you go all the way back to the January 27, 2020 deadline, which that's the deadline to identify revenues collected in the most recent fiscal full year, and then all the way up through 12/31/26. If you remember, and one of the key concepts to always keep in mind was when I said this before, that CRF money came out. It was short term, very pressing. If you remember, we're all under the pressure about the 1 year to get the money out the door. So there was short term and pressing needs. The American the ARP comes out from the conversation we've just been having here, and from what the rule says is, it's for general fiscal. Obviously, it's got a longer timeline. So if you go on, a couple things there that Section 603 defines incurred 12/31/2024, which gives you some time to kind of think that through. So obviously the funds have to be obligated by 12/31/2024. You can see them on the lower side there, and then defines the period of performance as of 12/26, which gives you the ability, hopefully, to complete any project along the way. So obviously, a bunch more money makes things additive to the monies that has already been received. Ratchets up the complexity a little, but gives you the ability to do more things and a longer timeline. So with that, I'm going to stop right there. I'm going to turn it over to Jeff, and he'll talk through a little bit in terms of some considerations that you might think through.
Thank you, Rory. Appreciate it. Kate, if you can move slide to the next slide. So thank you, everyone. With any major program and anything that's maybe have a limited amount of funding, you need to really look at how you want to address the new program. These aren't anything you probably haven't thought of. Again, I'm not going to read every bullet on all the slides, but we always look at everything as first you look at what's your strategy and what are your people, technology, and process issues, right? So how do you balance your strategic priorities and meet the federal requirements? Do you put in a technology solution, or do this technology you have work? One of the things we're finding is it's easier sometimes to go out and get a third-party cloud technology solution that you can stand up and use quickly for a short period of time to get this program going. We've seen many of our clients do that rather than try to go in and change your current systems, which can take, you know, many months and you're behind. So one of the things we've been helping our clients with, what should they do with their technology? Then looking at your processes, right? I mean, you want to get the money out the door. You want to be helping the constituents or the projects that you're going to be funding. And what is the best way to do that? All that in, you know, consideration of, you know, you're going to be judged on some point. You're going to be audited. You're going to be looked at to just spend the money right. So when you're doing these, you know, one of the things we bring in the eye to and we tell our clients is, you got to look at the fraud aspects. You're going to have to look at, you know, you're going to have to be compliant, and how do you set this up at the beginning so that when you're getting audited down the line and you're being judged on how you use the money, that you have the data and you can answer the questions, not only to your regulators, but also to your constituents who are hopefully benefiting from the use of these funds. Next slide. So again, you know, there's a lot of technology words here, but you know, first thing is what do you have? You know, there's two pieces. There's the financial management piece on the technology of, you know, we have to account for everything. We have to do financial statements. We also have to know where all the money's going. And then there's the case management piece of, depending on if it's a project that you're funding or if you're helping various individuals, how are you keeping track of that by either case management or project management? And how can you do that in an expedited way so that you're not spending a lot of time just getting ready to get these solutions implemented? With that, you know, we look at monitoring compliance as a major thing. What are the key risks? You know, how do you set this up so that when you have to report it, you can easily report it and it's not a whole exercise in itself at the end. The other thing is fraud management. And the reason we say fraud management is you want to mitigate your fraud risks. What we're finding and you're seeing in the papers every day with the UI program and some of the others, there's a lot of fraud out there. There's the bad guys are figuring out there's so much money here. They're going to figure out different ways to try to get at it. So the reality is you're not going to prevent it 100%, but how do you minimize it to the greatest extent possible and put in reasonable solutions for this? The other thing is things like call centers. Do you have call centers or do you have call banks, things like that you can easily set up or leverage, so when your constituents do have questions, that becomes part of the solution early on. Next slide, please. And then just one other set of considerations, and some of these may be a little farther down the line, but again, you know, what we look at is, can you take and use your current technology with some easy fixes to it without having to invest a lot of money? We're seeing things like advanced automation, intelligent automation, things like that, where you can go in and modify your systems pretty quickly without having to do a lot of coding to get the solutions to work together that you currently already own. The other thing is you're going to be asked a lot of questions on these programs as you spend the money. So what are your data analytics approaches? How are you going to be able to pull the data out and do the reporting that you're going to need, again, to your various constituents as you go forward? And again, did you spend the money efficiently, and did you meet the outcomes? So that's where the performance management really comes in. What kind of processes do you have? Who are you going to report to, whether it's your county legislature, board of supervisors, or however you're set up, as well as to the public? You know, you're going to want to be able to show, with all the money you got, how did you spend it? How did you spend it efficiently? And what were the outcomes that benefited the county and its residents? So that's going to be a very key thing to think about at the beginning, so that when you want to report things and you're getting asked questions, kind of think through the questions that you've been asked over the years. They're going to be similar, and try to build them in as you're putting your processes and data collection in place. Next slide. So, you know, when we look at this, and, you know, as we were talking with the NISAC team, they said, you know, talk about a few of the ways you normally help your clients. So one, at the beginning, assessing your funding options or rules and research use options. So before you spend the money, what is it? How can you spend? What is allowable? What does the program say? How does it interpret it? How is it going to then get reviewed later on and audited later on? So a lot of times we help the clients right up front. How are you going to spend this money, and what is allowable, what isn't allowable before you go forward. Again, help you to set up your program. Some clients, you know, they need help in some areas. Some clients that, you know, they just don't have a lot of staff, right? Everybody's been beat up over the years with budgets, and especially the last 2 years have been really tough. You know, do you have enough team to help you set things up? So how do you design the program? How do you implement it? And how do you execute the program? So there's various, we've been called in some cases where we're actually reviewing applications to just help us set up the systems, to just give us some guidance along the way. And then as you're going forward, you know, you'll have cases where you'll get asked questions, is the funding allowable for this, or is the funding allowable for that? A lot of times, you know, you just need a technical resource to help you figure out, as you're going forward, the new issue that comes up. And then the last piece, and very important, we've talked about this a few times, is funding use risk management. Big word for making sure you're compliant and helping to minimize or avoid fraud where possible. Next slide. So again, a lot of bubbles on this chart, but it's really mapping where the money's going, where the types of money, where can you spend the money. So we've looked at all the different program areas as Rory's talked about. Where do you want to spend the money? How's it allowable? In those kind of instances. So this just shows you, you know, taking a step back into where you're going to spend the money, and then how are you going to account for that money. Next slide. So this is a case study. Again, we're going to provide the slides, but you know, CRF funding can be used for the following, right? The pandemic and programs, premium pay to public sector essential workers, revenue replacement and loss, necessary investments in water, sewer, broadband, and of course, if you're state, critical capital projects directly enabling work education. So hopefully you can even take advantage of some of that. Counties can really see how to spend their CRF across the above uses and prioritize. So you got to step back and where do you want to spend your money? I know some counties are jumping right into it. Some local governments are putting advisory councils and panels together, which obviously can be a laborious, but you know, depending on the politics of where you are, sometimes that has to be done. So just looking at your strategy from where you're going to invest, what infrastructure you want to invest, are you replacing parts of your budget that you would have spent the money, or are you going to be able to do like some counties, pave a lot more roads or get some bridges fixed, or like I said, broadband, or getting the water systems up to snuff from where they were in deteriorating situations sometimes. So again, we're working through some of these and how to best use the funding and maximize that funding. Next slide, please. So some of the areas you'll see, we just put some examples here to show you. We've helped everywhere from a large state when the pandemic really started hitting them. You know, what could they spend the money on? How could they set up everything from their temporary hospitals? How do they track that money? How do they make sure they get reimbursed from the federal government when it came time? You know, we're helping a large Mid-Atlantic county with their, you know, how they meet the rules. We're helping them with, you know, testing compliance ahead of time before they get audited. Another county, New Jersey, where we're helping them actually with their application processing, because they just didn't have the ability to hire people quick enough, and it was easier to contract with a third party. And you can go through some of the others where we helped a large state with their Department of Commerce. Again, how could they use the money for economic recovery? How could they get the best out of this investment to actually help their economy and even attract people back to the economy faster? And, you know, we're helping some large jurisdictions in Florida as well with a lot of the same work. Next slide, please. All right, so we tried to keep it to 45 minutes, and we're pretty close, Mark, as far as any other QA they want to bring up.
Thank you very much. Thank you, Jeff, and thank you, Rory. There's a lot of information on these slides. They will be available to attendees. We will post them on our website this afternoon, and a recording of this webinar will be available as soon as it is rendered after this presentation. I want to encourage and invite attendees to submit questions on their panel. You can just write a question. We'll start taking those as they come in. The first question came via email. It is, my department is a small agency. It's a veteran service agency with a state reimbursement capped at $10,000 per year. We did have some COVID-19 expenditures for furloughed employees and emergency paid sick leave. However, we have not been able to request reimbursement for these costs because information on how to do so is lacking. What can we do to request reimbursement for lost work hours due to furloughed employees and emergency paid sick leave? If the county files on behalf of the Veteran Service Agency, can we get a portion returned to our agency budget?
Well, okay, so there's kind of two questions, within one there. So in terms of, where the rules reside, and again, this is where it becomes complex, right? So there's money emergency pay money set aside in just about most of the funding streams that have come out. So my first suggestion is where, where I look when I have a question like this is I go back to the FAQs. So, they're usually, to me, they're not, FAQs are usually not meant to be, that's the lone stop you should make, but FAQs usually give you at least a thread that you can start to pull on. It starts to reference back to the certain part of whatever funding stream we're talking about. So I always start with the FAQs. I know there's stuff in there about emergency pay and things along those lines going all the way back to CRF. So that would be the first place I'd start. And then from there, whatever references in there, I would then I would then backtrack into that reference and make sure that I could pull that apart. Because I think it sounded like the first question that came through said that, there's a lack of information. And I know around emergency pay in the beginning, like I said, around when I was talking about premium pay, there was a lot of questions around that. So I'm not surprised. But my understanding is that's actually improved a little bit. So there should be a little bit more information out there. And again, like I said in the beginning, get counsel if you can to kind of help you work through the weeds there on that. It is a little, it was a little convoluted in the beginning. It seemed like it was very, very broad and it was applicable. And then, as it started to, get some information around, it started to narrow up a little bit. Certain things were in, certain things were out, kind of thing. So, and then the second one, I'm not so sure I have an answer to that because I'm not so sure I have all the pieces. I think I'd have to maybe have a conversation with that person, and feel free to give them my contact information. I can help get that question answered. I don't know if I know off the top of my head. I think part of it is because I don't think I have all the information. So.
Well, I think embedded in the question also is that this is an agency within a county. So are you recommending that a county has a centralized area or a centralized person who will handle all of the ARPA tracking?
I think going back to something that Jeff said, we talked about, the structure and the tech and the processes. Yeah, I'll stick with just the counties that I've worked with. The counties that have, that had, sort of were promulgating standards, centrally, and then, making sure that they were educating the other agencies. If they had, sort of one stop, they had a tendency to do better. They had a conversation, they had a large conversation strategy sessions in the beginning, figured out that there was going to be one voice, one place, got the other operating agencies or departments involved, and then had a plan of attack and went through that way. Yes, they functioned, from my perspective, they seemed to function better. They had better supporting documentation, better rationale and things along those lines. So, would my recommendation be to centralize it? I guess it kind of depends on, who you are and where you're at, I suppose. But I can tell you that the ones that I've gone near where they've stepped back and basically went through the steps that Jeff was, explaining on the slides that he went through, where they discussed the strategy around it and, the performance measures around it and how they were going to handle questions and, making some determinations about what money you got the program, things along those lines. Those seem to go better.
Okay.
So I know that's a broad brush. It's a broad brush answer to that, but it really was, for some of them, it really was kind of that simple, like not sort of, shooting and then aiming kind of thing. It was the other way around.
Okay. And even if you're not the centralized person or agency in the county, that you help those centralized individuals by tracking closely those funds.
Yeah. So I would say that, in most places, if the money went down to a certain agency, the agency was on the hook to do the tracking of the funds. I've seen that almost exclusively everywhere. Whether that's the right way or not, I don't know. I've seen that almost exclusively everywhere I've gone.
Great, thank you. Can it be assumed that revenue replacement funds can be used to pay for anything county government has spent money on in the past without restriction? That's the revenue replacement funds.
So that's the revenue, back to the revenue loss slide. If you remember, there were some restrictions on that. So you'd have to go back and take a look at, what I indicated on those slides. In all of it, the overarching, restriction is, it's about augmenting and making things go easier related to the COVID-19. So if the back end of that is without restriction, no, there's always restrictions to this money. And again, one of the other things is, don't forget that there's, at least, three acts that have come out with, money earmarked for different things with different timing, but all very closely related. So one of the things you want to obviously look for is, you got to be very worried about duplication of benefits, right? I mean, that's the one thing. You don't want to be double dipping. You don't want to be spending the money on the same thing twice, that kind of thing. So that's a real concern. So the concept of without restriction, no, I wouldn't say so. Like, I would go back and take a look at that revenue loss slide that we had, things along those lines. There were some restrictions around.
Okay. Can you expound on whether revenues within the capital project fund are considered within the definition of the Census Bureau's definition of general revenue for purposes of the revenue loss calculation?
That one I'm going to have to take back. I have a thought on that, but let me research that. Actually, I'm actually at a conference this week, but one of the people that I have is got it down pat. So Mark, if you can forward me that question, I'll get that answer by tonight.
Will do. I represent a county. The state also has road and funding. Here's how do we coordinate the two efforts? State has road and funding. How do we coordinate?
I think I get the question. I think
okay.
you have the state's getting money for its infrastructure projects and the county's getting money for its infrastructure projects, and again, having that sort of coordination, and I think to increase the efficiency of the funding, right? I mean, you want to make it go as far as it can possibly go, things along those lines. I mean, Jeff, you might have
Well, I would just say I would start with your regional DOT office or the government affairs office at the headquarters, and then obviously you've got each your bucket of money, but then figure out how, when you're you don't want you blocking one road while you're trying to fix your road and things like that. So it's probably going to be more of an operational thing in my mind than a funding thing. But can you get the most least impact to your residents as they're getting the benefit out of it, I think. But I would start with your regional DOT office. That's usually the best way.
And the same question, the same person on broadband funding. So there's some state broadband funding and some county broadband funding, and how do you coordinate those, that tracking that funding?
Just trying to think again. You got to coordinate with the state. In this case, I think it's the Public Service Commission, and then who's putting out there. I was kidding. I was talking to the folks in Vermont 2 weeks ago, and they said you can't go down a road without seeing a utility truck putting up broadband. And so think of the topography up there. It's almost like the Adirondacks all over. I would start with that. Start with the Public Service Commission and ask them, what they're doing. Obviously, you're going to be going down the line. So who's serving what communities? Are they doing things in your community? If they're going to do something, then I'd move the money somewhere else, right? Try to maximize their money to your county, and then figure out how to use yours for what's left.
Okay, great. We've received CARES Act funding for our Health Services Department, Board of Elections, and Airport. It is my understanding that we have to report how the funding was used in order to avoid the clawback. Do we do this as one entity, or should each department register in the PRF to complete the reporting and complete it separately? In this case, Health Services will be reporting lost revenue while the Board of Elections purchased PPE and the airport is claiming salary loss. Has there been a reporting deadline set? So this is CARES Act related.
So I can go back and get the deadline information on the CARES Act. I'm pretty sure I know that off the top of my head, but I'll take a look at that. in terms of whether it should be centralized or not, I mean, I think of it this way. I think in most places, you know, where I've provided clients assistance, it's actually aggregated and reported centrally. Now, whether that's the right thing or the wrong thing, I think the big thing is you want to make sure, you know, one of the things I did notice in one of the states I was working at is that there were, you know, several agencies that sort of lacked coordination, and the money was being spent for very, very similar purposes. So, you know, I'm a big believer in the communication coordination type thing. It was one of the bigger, you know, comments I had back to several of the commissioners was say, hey, like, you know, it doesn't sound like you're talking enough. And I think that's sort of like that, you know, will seem to be sort of disparate things, but I think that, you know, the centralization and the coordination, you know, could be a good thing.
Yeah, I'm a big believer, especially your budget officer and controllers, the combination, making sure they're in on it to make sure, because again, you're going to have to report this in your financial statements, and it's going to be audited. So you don't want to have three different answers. I'd rather, you know, have that central point of contact with one point of view.
Okay, great. We have a couple questions left. I want to remind attendees that they can submit a question now, and if we don't get to your question, please send us an email and we will get that question answered. I will send Rory and Jeff a couple of questions that that they were not able to answer right now. As a county, we furloughed employees. Is this reimbursable from the ARPA funds?
Yes, I think one of the things I talked about was, yeah, it went back to, it was one of the slides that I had. We talked about, where was that? I think there was a specific reference to furloughed workers in state and local government. So yeah, I think if you go back and you take a look at that slide, there's an explanation for that. But again, that's another one where the slides only do it, you know, a quarter or a third of the justice. You got to go back and make sure that there's no subtlety or nuance to that. But I seem to remember specifically referencing on one of the slides about furloughed workers.
Okay, great. And do you recommend using the ARPA funding to cover future debt, since it is one-time funding?
I think that was under the ineligible uses was debt costs, I believe. So again, that would be a good thing to go back, check in the FAQs, unless I'm misunderstanding that question. But my understanding is, you know, the debt side of things was ineligible.
Okay. And then I have a note from Rebecca Murphy with a link to PRF reporting for the CARES Act, which we will post on right below the slides and the link to this webinar. Thank you, webinar recording. Thank you, Rebecca. One more on the revenue loss calculation. Is it based on total revenues or line by line? So if the total revenues are flat or up, but there are line items that are down, can you base your revenue loss number based only on the line items that are down, or do you have to use the total revenue number?
I thought it was, and again, off the top of my head, I remember it being aggregate, but I can check that, because there seems to be some validity to that type of question where you can see where, you know, a certain section was up and another one was unduly burdened and things along those lines. So I'll check that. Okay.
Well, that's all the questions we have today from our attendees. I'd like to thank attendees for joining us this afternoon, and a special thanks to KPMG for lending their time and expertise and resources. They are available for more questions, and they have some programs for counties if you want to contact them to work with your county. Jeff and Rory, again, thank you very much for your expertise today.
Thank you, Mark. Thank you, everybody.
Thank you very much. Thanks, everybody.
Have a great day.